So Adrian's the founder and executive director at the Bradbury Sullivan LGBT Community Center in Allentown. He also serves on 2 commissions at the appointment of Governor Tom Wolf, the Commission on LGBTQ Affairs and the Pennsylvania Human Rights Committee. He's the editor of a forthcoming book that's called, let me look at my notes, Bodies and Barriers, Queer Activists on Health. He's also a co-editor of a chapter on tobacco use in the LGBTQ community in a book called The Rutledge Handbook on LGBTQIA Policy and Administration. And you know, Adrian's just, I've had the pleasure of working with Adrian for a few years now. As we've been looking at how to address tobacco use in the LGBTQ community. He's really just a tireless activist, an advocate, and he's just dedicated his entire career to advancing and progressing, helping to make progress in the LGBTQ community, kind of in all aspects of our lives. And so I'm just excited that I got to introduce him a little bit. I'll stop talking now, but here's my good friend, Adrian Shanker.
Jamie, your password.
Oh, okay. Go ahead. There you go.
Good afternoon, everyone. I'm so glad that this day is going so well here at this wonderful conference. And can you all hear me? Yeah? Okay. So prior to 2014, I really knew very little about tobacco in the LGBT community. I certainly didn't think that it was one of the primary issues that I would be working on for the next few years, and I wasn't aware of how harmful tobacco was for the LGBT community. I had been leading Equality Pennsylvania, which was the state's civil rights organization for the LGBT community, for 3 years, and my focus was really on legal rights, especially around non-discrimination and marriage equality. So I wasn't really thinking about health equity in the same way. And when I was doing that work for 3 years, going around the state to lots of different Pride festivals, I wasn't really thinking about how were Prides incorporating LGBT health into our civil rights journey. It wasn't on the top of my mind as an LGBT activist. That all started to change in 2014 and 2015. 2014, I met Scout, who you heard from yesterday, and he started to mentor me in understanding tobacco as an LGBT issue and also how to effectively do this work. In 2015, we did our first needs assessment, which some of you who came to our breakout session yesterday on data saw some of the most recent data. But in 2015, our early data was so transformative for me in understanding just how critical this issue was. So this afternoon, we're going to talk about smoke-free prides. Essentially, how can collaborations between LGBT community-based organizations and public health agencies work together to improve the health of our community? And I want to stress the word collaborations. In other government versus private sector partnerships, we talk about it as public-private partnerships, and this is really the same type of thing. We're talking about how do we work together between sectors, between LGBT activists and public health professionals, sometimes with the government and sometimes with healthcare agencies, to achieve better results that actually meet all of our goals. So in 2014, when this work started, out of all of Pennsylvania's Pride celebrations, there was 18 at the time, 0 were smoke-free. 0. And we should start by just talking about what's Pride about. So this is Pride Month. June is Pride Month. That often means that there's a lot of shirts at, and I don't mean to slam any company, but shirts at Target with rainbows on them and stuff that Listerine made like a Pride mouthwash, and that's not what Pride's about, though. It's a nice thing to be able to see like support for our community, but really it's not about that. What it's about is much deeper. So the first Pride Festival happened in 1970, a year after Stonewall. It was the Christopher Street Liberation Day. It was the first annual remembrance of the Stonewall riots. Pride started as a riot. It started as as commotion. It started as fighting back against police brutality in a mafia-run gay bar in New York. It started as literally throwing bricks at the cops who were beating them up and arresting them. That's how Pride started. So what is Pride about? Liberation, visibility, rights, certainly celebrating how far we've come, but in many ways continuing to fight for the right to be ourselves. That's what Pride at its heart is about. So when people say, hey, we're going to Pride, that's what they mean. And they might not consciously mean it, but as a community, that's really what we mean. We mean that we're not done yet, right? It's not just an opportunity to put a fun rainbow shirt on. It's an opportunity to be seen as who we are and to continue that struggle for I'm going to use the word here, equality, but what I'm really talking about is legal, social, and health equity. So some goals. So the goals of this work around smoke-free prides. Ensure that Pride celebrations include a focus on LGBT health. This was not really happening in Pennsylvania before 2014. Making sure that Prides are a place where anyone who goes can breathe clean air. Connecting LGBT smokers who want to quit, and stressing who want to quit, not who happen to be smokers, people who want to quit, with evidence-based resources to help them quit. And of course, the ultimate goal, the dream, the impossible thing to reach in 1 year is the elimination of tobacco disparities and the promotion of health equity. Ultimately, the achievement of health equity, which we know is that lofty and unfeasible goal in the short term, but something that if we strive for, if we actually work for it consciously, we can achieve it in the long run. So some challenges. I have not been. You've been clicking. Wow. Okay. I'm like, wait a minute. Where's the other clicker? It was a long night, so don't even know where I am. So some challenges. So high tobacco usage, and Jamie's amazing because she's clicking without the super secret hand signals, which I promised that I would give her. So she's managing to follow my crazy anyway. So thank you. So some challenges for this work. So high tobacco usage in the LGBT community. We have more than double the rate of tobacco usage in the LGBT community. For some parts of our community that are even more disparately affected, we see higher rates among LGBT youth, as an example, among LGBT people of color and among trans people, higher than the rest of the LGBT community, which is already double the majority population. So really, really significant disparities. In some parts of Pennsylvania, the trans community smokes at hovering around 50%. That is an enormous difference from the 18% of the majority population. So the high tobacco usage is the biggest challenge. Historic tobacco industry sponsorship of Pride events. So for a long time, the tobacco industry was the main sponsor of a lot of our biggest prides in this country. And at the time, frankly, it was welcome, right? LGBT organizations were very open and interested in seeking sponsorship from any company that would be willing to have their name attached with gay pride for a long time. And the tobacco industry certainly partnered with a lot of these agencies to do so. And it was not seen as a negative thing for a long time. The lack of knowledge within the community about tobacco as an LGBT issue is probably the greatest challenge. For so many people who I interact with every day as the director of an LGBT community-based organization, they don't understand why we work on tobacco because they don't see it as an LGBT issue. They see it as, oh yeah, we know tobacco is bad, but it hurts everyone in the same way. What's unique about us, right? We have to actively normalize the conversation of tobacco as an LGBT issue and continuously present the data and the trends that show just why our community smokes at higher rates, because it's not biological. It's based on social and cultural factors that are beyond an individual person's control. Things like minority stress and increased bullying and discrimination and violence, harassment, all the social indicators of smoking, matched with historic tobacco industry targeting of the LGBT community, and which continues with targeted advertisements in specific LGBT media outlets. So there's lots of reasons why these numbers are the way that they are. So what does a partnership look like? It looks like social norming. Tobacco is an LGBT issue, saying that over and over and over again. In the same way that we talk about immigration as an LGBT issue and abortion care as an LGBT issue. The LGBT movement is an intersectional movement with many identities and many different challenges, and we're constantly talking within community about all these other issues as LGBT issues, but we frequently leave out health. We frequently forget to talk about tobacco, and the only time that health often comes up is when we're talking about sexual health, when we're talking about HIV and other STIs, sometimes when we're talking about chemsex, the use of substances to facilitate sexual activity. But when we're talking about tobacco, we're often not thinking about the LGBT movement, and that's one of the biggest problems. Clean air. We want to limit secondhand exposure to tobacco and related smoke products at Pride events. Cessation, we bring tobacco dependence treatment providers on site to actually provide cessation support immediately through direct interventions at Pride festivals. And this is the biggest one, tobacco-free declarations. All the prides that we partner with agree to no tobacco sales at Pride, no tobacco sponsorship of Pride, and no tobacco vendors at Pride. So what we did is that we piloted in 2015, Jamie's going to yell at me later. We piloted in 2015 3 Pride festivals in the state: Lancaster Pride, Reading Pride, and Allentown Pride. And the first 2 we piloted as 100% smoke-free events. And the last one, Allentown, where I live, we piloted that as a partially smoke-free event with 3 areas of the festival where there would be no smoking. And we wanted to test, which model might work best. It was the first time any of them were going to go smoke-free. We didn't know what would work. So in the first 2, Lancaster Pride went off without a hitch. Nobody really cared that it was smoke-free. I mean, nobody cared from the perspective of no one was out in the streets angry that it was a smoke-free event. Reading Pride had all the vitriol, all of the attacks. You're banning smokers from our festival. Our community deserves to be able to make our own decisions about our health. Those were the kind of things that we heard from a small vocal minority in Berks County about tobacco-free Pride. And in Allentown, people were saying, how come you only picked 3 areas of the festival to be smoke-free? They were like, this makes no sense. You made the stage smoke-free, but people are smoking when they're walking to the stage, right? You made kids' space smoke-free, but people are smoking all around it. It didn't make sense to anyone. And so, but we needed to know that. We needed to understand that it actually wouldn't make a difference for people if it was partially smoke-free or fully smoke-free. So fast forward to this year with a different font because I made a mistake on the slide. Clearly. So fast forward to 2019, and these are all the smoke-free prides. So Allentown and Reading, Lancaster, Milford, York, Harrisburg, Erie, New Hope, Chester County, Knoebels Pride in North Central PA, Scranton, Doylestown, and People's Pride in Pittsburgh. Noticeably absent, though, are Pennsylvania's 2 largest Pride festivals. Pittsburgh Pride is the largest, and Philly Pride being the second largest. And so those are some noticeable omissions, but every other Pride festival outside of Philadelphia and Allegheny County are 100% smoke-free events. That's pretty damn amazing. Part of the reason that's amazing is because the tobacco disparities are worse in rural communities than urban areas. We have higher tobacco usage in the LGBT community in our rural counties. And yet those were the first ones to make this move. I saw Ciara over there, so she deserves a big shout out because People's Pride just went smoke-free right before their festival. And so Ciara runs that event, and in partnership with Tobacco Free Allegheny was willing to do this kind of at the last minute this year. So just as an example of how partnerships can work. I want to share with you what smoke-free prides look like. And we have to play it from there. But before you play it, I'm going to explain this. So Jamie and I do a lot of work together in Southeast PA, along with my team, Atticus and Anne-Marie, who you may have met, and they may be in the other room right now. But as a team, we do tobacco-free Pride work throughout Southeast and Northeast as well as like North Central and South Central PA, working with both American Lung Association and Health Promotion Council to promote smoke-free prides. Last year, we felt like, a lot of people still are asking questions. Why do this? What does it mean? What's the value of putting resources into pride festivals to make them smoke-free? So we thought, well, let's make a video to explain what this really means in practice. And we called the video and the campaign that we have around it, Living Proudly, Living Longer. Is there anyone that knows how to use a computer better than me and Jamie? Yeah. I'll talk a little bit about the video while it's loading. So we went to 2 Pride festivals to film. We went to Harrisburg Pride and Reading Pride. And the reason we picked those 2 festivals was because these are 2 festivals that have a lot of really great results that we've seen from being smoke-free Pride events. In Harrisburg Pride, which literally takes place at the foot of the state capitol, this was one of the earliest ones we started working with just a year after that pilot, and the results have been really amazing. It is one of Pennsylvania's larger Pride festivals, and we were able to work with them without much resistance in Harrisburg. And Reading Pride was really one of our top pioneers. So hopefully the video plays in a minute. So part of the reason that we wanted to highlight smoke-free prides is because the focus on health and human rights has lacked from a lot of our festivals in Pennsylvania, that we haven't had this focus, that for a long time Pride festivals here have seen more of a celebration of visibility than a celebration of the continuous struggle for equity. And historically, that's really what Pride was always about. So by focusing on health and human rights, we're able to achieve that goal. When we talk about living proudly, living longer, what we're talking about is reframing the tobacco message, that our movement for legal, social, and health equity has come so far that we can do things that we couldn't do before. We can choose to marry the person we want. We can identify ourselves in the bodies that we see ourselves as. We can truly be ourselves in so many ways, but we're letting these like little things get in the way, like substances that are targeted to us and that are really causing harm for the community. Do we think that's buffered enough? Okay.
Welcome to Pride Fest. Welcome to Pride Fest.
Welcome to Pride Fest.
Today's Pride Fest is both smoke-free and vape-free because we believe that we want to protect the air and make sure that everyone is able to breathe clean air at this festival and have an enjoyable time.
The LGBT population smokes at double the rate of the general population, the leading cause of death for LGBT people. So we're like, okay, we've got to do something about this.
We have teamed up with the Bradbury Sullivan organization to host this smoke-free event, and we've been working with them over the past 3 years.
Bradbury Sullivan LGBT Community Center has been proud to work with Pride festivals to go smoke-free. So it's up to us to take our health in our own hands and make sure that our spaces, our festivals, our bars, our community centers are smoke-free events. And Reading Pride was one of the first. They were one of our pioneers to go smoke-free. We show up and we hand out LGBT smoke-free stickers to make sure that LGBT people know that they're not the only non-smokers at the festival. We want to create spaces where people know that there's other non-smokers around them. And we also want to educate the community about how tobacco is always an LGBT issue.
The tobacco community has targeted LGBT folks, and particularly for young LGBT people, as we're learning certain behaviors that we're going to pick up for a very long time, to be able to have a space where our prides don't have smoking around them, to show that you can have a great community without the tobacco industry being involved at every step of the way.
It's important to promote smoke-free and healthy living in Harrisburg because we have a lot to live for. It's something to be proud of and want to live happy, long lives and do that.
Living longer. I'm going to live to be 107.
LGBT smoke-free.
LGBT smoke-free.
LGBT smoke-free.
LGBT smoke-free, living proudly, living longer.
So with apologies for tech issues, the website for that is bradburysullivancenter.org/LGBT smoke free if you'd like to watch it without blurriness and with sound that works. But Okay, that wasn't planned. So when we go to these prides, we're not just saying be a smoke-free pride. We're saying we're going to really make this about health and equity. And the way that we do that is by creating clusters of visible non-smokers so that it's really clear that the people going to Pride actually appreciate it's a smoke-free event. So we hand out these stickers, they say LGBT smoke-free. Almost everyone at Pride ends up wearing them because who doesn't want to wear a sticker? Right? Everyone wants to wear stickers. And it's like half the fun of going to Pride is getting stickers. So everyone wears these stickers. And what we've actually seen is 2 gay bars have gone smoke-free as a result, one in Allentown and one in Harrisburg, because in part they've been able to see that there's a lot of LGBT people in their communities that are non-smokers. It takes away the argument that, oh, we're going to lose business if we go smoke-free when there's a successful smoke-free Pride event in the same community. And as an outdoor event, some of these festivals take place in parks that are technically smoke-free anyway. But the difference is that there was no signage. No one was really enforcing it. We put signage throughout the entire festival that says, "Welcome to a smoke-free Pride." At one of the festivals in Chester County, they've actually started marketing the fact that it's a smoke-free Pride to recruit more parents with young children to come to Pride. And they're saying, this is a Pride festival where you can bring your kids because they won't be exposed to secondhand smoke while they're here. Wow, what a great way to grow your event. And this is a small startup Pride in suburban Philadelphia, where there's a lot of parents of young kids. They've done really, really well with that by being able to grow in that way. There's a festival starting, it's actually this week in Doylestown, and they're using the same message. They're saying, we're not a big city Pride. We're a suburban Pride in Bucks County, and we're smoke-free, so you can bring your children to this event because they'll be able to breathe clean air. That is such a powerful message. And it's a message that's authentically coming from the LGBT community, not coming from the government or a health organization or a hospital. It's coming from trusted LGBT organizations. And that's the big difference. So when we go to these prides and we bring tobacco dependence treatment providers with us, they don't sit at their own booth behind a sign that says the name of their health network that they're affiliated with. They sit with us at our community center's table. And when people come up to us to talk about, why is it a smoke-free event, we say, hey, if you're a smoker, we actually have someone, you can make an appointment with them and meet with them afterwards. Or if they're like, well, I don't know about making an appointment, then we can give them the phone number for the tobacco-free quit line, and they can get 8 weeks of free phone counseling that they can schedule when it works for them. So the direct intervention already happens at Pride, and it's not like a barrier over, oh, am I going to really go up to the hospital's booth? Because for some people at Pride, they don't want to do that. They want to talk to LGBT organizations. So we make that possible by working directly with us to put the tobacco treatment at the LGBT Center's booth. And that's been really, really powerful. What can public health agencies do? So the first, if you want to, just show of hands, anyone who is a tobacco dependence treatment provider or has tobacco dependence treatment at your agency? So about half. If your agency provides tobacco dependence treatment, make sure those staff members that provide that treatment, I would argue all health providers, but if we're just going to talk about tobacco, fine. Tobacco dependence treatment providers especially need to be trained on understanding LGBT barriers to health care. Specifically, this is different than cultural competency training. I want to be really clear. Cultural competency training is like baseline, lowest common denominator. Don't use inappropriate language. Understand the cultural context when your patients approach you. That's really important. This is the next step. Understanding barriers to care, barriers to accessing care. Those can be geographic. They can be cultural. They can be systemic. They can even be a policy barrier that is that the only fix is governmental. But understanding what those barriers are, and then understanding promising practices for actually reaching the LGBT patient population effectively and getting people to adhere to the treatment that you want them to adhere to. Because adherence is one of the biggest issues with historically underserved populations. And we know that from looking at HIV care as well. So adherence is a really big issue, and you can't expect that the same strategies for adherence will work with the LGBT patient population as with the majority population, because they won't. It has to be totally different strategies. So training specifically tobacco dependence treatment on barriers to care and promising practices for effective care is really important. The second piece is be at Pride. If you want people to go to you, go to them. So there's a Pride Festival in almost every part of Pennsylvania, with some noticeable exceptions in part of Western PA, in between Erie and Pittsburgh, and parts of North Central PA, in between, well, actually all of North Central PA, in between Erie and Northumberland County. So most of North Central PA lacks a Pride. But for a huge section of the population of our state, like vastly more than 75% of where people live in Pennsylvania is covered by communities where there's a Pride Festival. If you're at a health organization, be at Pride. Whether you're doing it through a more formal partnership with an LGBT organization, or it's simply you have a vendor booth and you're printing some materials with some rainbows on them so that people can know that you're trying to be affirming, that's a good first step. But develop culturally affirming messages. One of my favorite things is hearing from a healthcare organization that they tabled at Pride and nobody came up to them and they didn't get any result from it. And I'm like, well, do you have a picture of your booth? Right? And then they send me a picture, and it looks like super, super boring. And I'm like, nobody wants boring at Pride. Like, that is not going to work. Like, create a selfie stand, or give out fun materials. Like, make stuff that's relevant for the event itself, and then people will come over to you. Cancer screenings are really a great thing to be promoting at Pride festivals, because we know that only 1 in 5 LGBT Pennsylvanians has a personal doctor. So that means that 4 in 5 don't. So 4 in 5 LGBT Pennsylvanians probably aren't being given regular information about routine cancer screenings. It's a great opportunity to promote everything from culturally affirming Pap testing to mammograms to lung cancer screenings, promoting HIV testing at Pride, promoting a variety of health services. But when you promote health services at Pride, it's super important to use affirming messages, creative messages that will work. So I'll give an example. If some of you stop at our booth either before or after, you might have seen our postcard for our Taste of Peaches campaign. So we have a campaign called the Taste of Peaches. It's an emoji campaign, and it's kind of edgy. We have a Hep A outbreak in Pennsylvania declared by our Secretary of Health. An outbreak is pretty serious. Hep A is a communicable disease, meaning that if, it's not only based on a specific person's behavioral risk, it's communicable. It's spread through everything from restaurants to sexual activity. We have to do something about this. So even before we had the outbreak, we developed this Hep A campaign that was very different from the campaigns we've seen in other communities. In Chicago, as an example, they had a Hep A outbreak last year, and the Chicago Department of Public Health put hand washing stations in gay bars, which does not work for the reasons why gay men are receiving Hep A. So it wasn't because of hand washing. We developed a campaign with emojis. It was the peach emoji and the tongue out emoji. And it says, if you like the taste of peaches, consider if the Hep A vaccine is right for you. Magically, we have had a little bit of a better response than they had in Chicago, where nobody cared. Right? So develop messages that actually reach the community, and if you don't have LGBT people in your organization, bring in an LGBT organization to help you create those messages, because they're going to be more authentic if you have people in the community helping to craft resonating messages with you. Offering on-site health programs in LGBT spaces. So something else that we know about LGBT Pennsylvanians is that LGBT people say they feel more comfortable receiving, for example, HIV testing in an LGBT community organization or at the primary care doctor, not in like a public clinic. That's going to be very similar, even though we don't have hard data on it, very similar to other health services. LGBT people really want to receive services in LGBT welcoming and affirming spaces. So whether that's at your Pride event, or whether it's at a community center, or even a gay bar, there's great ways to do direct outreach. And this thing that the HIV movement learned really early on, is anyone a provider of HIV prevention services? A couple? So in the HIV prevention world, direct outreach to reach the targeted population is the norm, not the exception, right? So we're going to go do HIV testing at the gay clothing optional campground and at the gay bar and at the Pride event. Sometimes even reaching out into adult bookstores to actually do prevention directly with the highest risk population. In our digital era, that means using apps where people are to reach them with prevention messaging. But in the tobacco prevention and cessation world, we haven't done that. As a movement, we haven't done that effectively. And I would actually argue that in most health areas, we haven't done that effectively, with the exception of the HIV prevention world. That we haven't actually done a very good job of direct outreach to the targeted population, which just makes no sense. Right? We know that we have a targeted population, but we don't reach them. Instead, we assume that the messages that will work for the entire population will work for a historically marginalized population. So I had a funder who told me, this was not a health funder, they were a funder of services for to provide financial planning assistance for low-income Americans. And we asked them for support to create a program for LGBT youth who have experienced family rejection due to familial homophobia and transphobia, and that they might need some assistance learning about things like managing their finances, right? They don't have a birth family to care for them in that way and to train them. Well, the funder came back and said that they think that the LGBT population is too specific and that they only want to fund things that reach all Americans. And I never write back to a funder with what I said to this one. So what I said to this funder was, with all respect to the relationship where you are the controller of the funds, I think that you're misunderstanding how to reach underserved populations. Because if you use a message that you say reaches all people, what you're really talking about is reaching only the privileged people, only people who are already being reached with your general population messages. You're not going to reach people of color. You're not going to reach LGBT people. You're certainly not going to reach homeless LGBT youth, some of the most vulnerable people in our community, with a message that is for the entire population. And similarly, if we're going to do messages for the LGBT population, we can't do it in the same way. We can't just throw a billboard up on the highway and say, "Hey, gay youth," right? We're that's not going to work. We have to actually go to where the queer youth are and find them. And some of us who do work with queer youth populations know how to find them, right? And we already know where they are. But we actually have to do that, and that's the difference of offering on-site programs versus programs that take place in a hospital or a public clinic, where there's an expectation that you'll go to them for care, right? You'll go to them for that Pap test or the mammogram. What does it look like if that mammogram can come to you? And some of the barriers to care for LGBT people involve fear of going to a doctor, fear of going to a healthcare space. We actually know that half of LGBT Pennsylvanians and 3/4 of trans Pennsylvanians in particular say that they've had past negative experiences that cause them to have fear going to see a care provider. That's enormous. So what are we going to do about it? Well, we can bring the care to them, and we can bring it to them in trusted spaces. So when we're talking about how to actually reach the population, that's what we're talking about. So just to circle back to Pride before we close, and I can have some time for questions if there are any. Smoke-free Prides are more than just an in thing right now. This is about changing the landscape of what Pride means, to renew a focus that has always been there since the beginning of Pride, which is the goal of seeking health and human rights for the LGBT community. Early on, that focus on health and human rights was focused on, maybe eventually getting the government to care about an entire generation of queer men dying from what we now know is a treatable chronic illness, right? Now, it's focused on what are the early causes of the preventable early causes of death for LGBT people. And we can win that fight if we renew that focus. But we're only going to win that fight if healthcare organizations are there with the LGBT community. We're not experts in public health as LGBT activists. That's not, we didn't go to medical school. We didn't go to nursing school. We didn't do those things. but we know how to reach our community with messages that will work. So partnerships can help us to achieve that. I'm happy to take any questions if there are any. Yes, there's a question over. We have a microphone that's going to come around so everyone can hear. Right in the back? Yeah.
Thank you.
While we're waiting for the question, I neglected to say one thing at the beginning, which is that the Pennsylvania Department of Health has been a tremendous ally in this work. And in 2014, something else happened, which I should have started this presentation with. I had planned to, but I forgot. The Obama administration put out a mandate to every state that said that they have to have a written plan for how they were going to address LGBT tobacco disparities. And Pennsylvania Department of Health, their plan was, we're going to partner with community-based organizations to address LGBT tobacco disparities. So we've had some really great partnerships, and this wouldn't be possible without the Department of Health saying, we're willing to step forward and help to achieve some results. So I just want to give them some credit. Some of them are here. I know Sue McLean and Nancy Miles, they're back there. So maybe we can all just thank them really quick because the Department of Health has been a great partner. Okay.
So we all know how environmental addictions are, and nicotine being widely available because it's legal in our environment. As you said in your presentation about it was kind of nonsensical to have smoke-free zones in a pride. It kind of feels a bit nonsensical to have a smoke-free pride in such a smoke-laden city. Mm-hmm. I moved here from Montgomery County in Maryland, which is an entirely smoke-free county, so it was very shocking to come here and just have smoke everywhere.
Right.
And it's like, people hand you cigarettes at the bus stop. Like, I can't go to a bar unless I'm okay with, inhaling a lot of smoke. So what do we want to do about Pittsburgh's smoking problem to make it easier for our LGBT population to avoid smoking and quit smoking too? Because it's hard to quit when everyone around you is smoking.
It is. So I want to answer the first part of that question first, and then I'll try to address the second one. So the first part of the question is, smoking is environmental as well as personal. So from a personal standpoint, tobacco cessation makes a big difference, but all of us experience secondhand exposure throughout our lives because America also has a tobacco addiction, right? So you walk anywhere and you are passing by people who smoke. So what is the benefit of a smoke-free pride in a community that isn't entirely smoke-free? I would just suggest a couple things. So one of them is that the answer isn't only environmental. So it's also policy change. We're requiring that these pride festivals divest from receiving funds from the tobacco industry. That's part of it. We're also putting signage up that reminds people why it's a smoke-free event and why tobacco is an LGBT issue. And we're providing on-site cessation services. So from a personal standpoint, those are some of the reasons. From a community standpoint, we got to start somewhere. Right? So we have to build support for smoke-free communities. Part of the way that support builds is by more and more agencies developing smoke-free policies. Those agencies can be a workplace. They can be a government that says all our parks are smoke-free. They can be an outdoor event or an indoor event in spaces that just want to remind people about the harms of tobacco on our bodies. So I would suggest that we have to start somewhere, and a great place to start is from the margins. And what I mean by that is if we start making our communities smoke-free with the queers leading the way, that's pretty amazing. Like if the people who are often most marginalized and left out can lead the way for our whole community to be healthier, what does that say about our movement? So it's not going to fix the globe's problems, but it'll start in a place where within our own events, and to be fair, I agree with you, a smoke-free section at an event or in a city is like a peeing section in a swimming pool. It's like it's air and it gets around. I do agree with you, but I also think that the more spaces that we can make smoke-free means the more clean air is available to us. Now I want to answer the second part of your question, which I don't live in Pittsburgh, and I just want to say that there are people who are activists in Pittsburgh who can answer this maybe more authentically. But what we've seen in other parts of the state is what I can answer. So in other parts of the state, I'll use Harrisburg as an example. So Stallions, which is one of the 3 gay bars in Harrisburg, one of the 3 gay bars was already smoke-free. The other 2 were smoky. Stallions was smoky. And after seeing the Harrisburg Pride Festival be smoke-free for a couple years, they made the change to be a smoke-free bar. In Allentown, Stonewall, our only gay bar in the Lehigh Valley, changed to be a smoke-free bar after seeing our Pride event be smoke-free for, at that point, 3 years. These changes take time, but ultimately we need leaders in our local communities to be willing to prioritize health as an LGBT issue, prioritize tobacco cessation as an LGBT issue. I could be cynical and say, the reasons why I think, for example, Pittsburgh Pride isn't smoke-free, but I don't want to speak on behalf of Pittsburgh Pride. I have nothing to do with that organization. I think you should ask them why they're not smoke-free. Why are they the only one of the only prides in the state that isn't yet smoke-free? And those are questions that LGBT activists and health providers should be asking. Why do bars seek exceptions to clean indoor air? We should question them. It's perfectly okay to go into the bar and ask to speak to the manager and ask why they applied for an exception for clean indoor air, because do they really think it's a good idea to harm all of our health and prevent those of us who want to take care of our bodies from going to those venues? I actually think consumers drive a lot of the decisions. If you're a bar owner and you hear from some of your customers saying why are you allowing smoking in this bar? They listen to that a lot. And so, communities focusing on this issue is the number one way that it will change. And maybe the one other thing that I would say is that we have to remember that the LGBT movement has a lot to be concerned about right now. And so, while this is a super important issue, we have a federal government that is turning back LGBT health rights left and right from their denial of care rule, which, by the way, Bradbury Sullivan Center is the plaintiff suing the Trump administration to stop that rule because it's so harmful to our health, to repealing Section 5057, which is non-discrimination in health care for health insurers. I mean, there's a lot to fight for when we're talking about securing queer health in this country. But one of the things we need to be fighting for is against a very powerful industry with a very powerful lobbying arm who has maintained a presence in our community for decades, even when we now know that some of their tactics were incredibly insensitive, incredibly homophobic, and also, literally shortening LGBT lives. Are there any other questions? Yes.
Hi. Thinking about, tobacco-free pride, I totally agree with that. I think that's a great start. But it also makes me think of addiction in general as a unique LGBT issue. It made me think, once we get this accomplished, because we probably will, how maybe we could, I don't know if you think sober pride should be a thing, dry pride, or if that's something that's achievable or even something that we want, just because of how prevalent addiction can be, and how when I went to Pride this summer, just the amount of just alcohol around me and all these places, I just would think for maybe LGBT people in recovery, that might be a triggering space for them.
Absolutely. I want to shout out and introduce you to Atticus. Could you stand up for 1 second? So that you can meet Atticus afterwards if you haven't already. He's our health programs manager at Bradbury Sullivan Center, and he has a lot of expertise in LGBT people working around addiction and recovery. So maybe that would be a good question afterwards to ask one-on-one. I can share some of my thoughts, though. So first, at our Pride in Allentown, which we took over last year, we this year are adding a sober social space at Pride. I think that it's a whether it's right or wrong, it's a big lift for prides to go completely alcohol-free, in part because of money. And I will say that the way in which prides have gone smoke-free is through what's called replacement costs, so sponsoring prides to be smoke-free. Most pride revenue, a lot of prides, is very alcohol-driven. If there's going to be a strong desire to remove alcohol from prides, there's going to need to be a strong desire to make sure that LGBT organizations running pride have the money to put on the event. And that money can come from other sources, including alcohol-free, substance-free sources. But there needs to be some ability to make sure that prides have the opportunity to exist. Right? I think that there is one big difference between alcohol and tobacco, and that's secondhand exposure. So while I don't disagree with the substance of what you said, I also think that what we're talking about when we're talking about smoke-free prides is less about an individual smoker and more about reducing secondhand exposure. We're also interested in helping those individual smokers who want to quit to be able to do so, but we're really talking about the community who's attending, having access to the smoke-free event. Some of the bigger issues around substance use in the LGBT community deal with some other substances besides alcohol. So with our smoke-free pride agreements, we're clear with festivals that that includes marijuana. And this is not a debate about legalization of marijuana. It's about secondhand exposure. So we're saying like secondhand exposure of any smoke-related product cannot happen at a smoke-free pride. People have asked, some of the prides have asked about medical marijuana, and we've said that if somebody has a medical card and they're using a smokeless product, that's not what we care about. We care about the secondhand exposure at the event. But we also know that like substance use is a significant issue in the LGBT community. What we're piloting at our Pride this year, I'll let you know next year if it worked, having we call it sober social space at Pride. So we made one of our 2 stages sober social space, so people won't be able to carry alcohol in, and they'll be able to enjoy Pride the entire day with full day entertainment with no presence of alcohol around them. We're hoping that that might create a balance. We also might learn that the same thing with tobacco exists with alcohol. I don't know that yet. There's lots of opinions, and I'm very interested in learning. Are there any final questions? Yes, maybe one more over here.
Sorry to make you run a marathon. Mine is like more of a comment than it is a question, but one thing that I've been kind of thinking about through this whole section is the reason like people smoke, and it's like a lot of it has to do with like stress relief, you know? So that got me thinking like it's not really enough like to just try and say don't smoke. Like there has to be like to like give people initiative to stop smoking. I feel like we should also like provide like alternative coping mechanisms, you know?
Mm-hmm. I would say that's, first off, I think you're right, and I appreciate that comment. I think that the reason people start smoking is because of a need for coping mechanisms. I think the reason a lot of people continue to smoke is because nicotine is highly addictive. And what we know is that a huge number of smokers say that they want to quit, but that they don't know how. It also takes most smokers a number of quit attempts to be able to quit. So I would just challenge a little bit that the continued smoking is not always out of coping, it is sometimes out of an inability to stop smoking. So in terms of other coping mechanisms, I think you're right. We need to have so many better supports in our community, from community-wide mental health supports to policies in public schools that adequately deal with bullying, and policies that prevent workplace discrimination and housing discrimination. All of these things are completely interrelated. The reasons why people smoke are largely related to social conditions around us that cause at-risk populations at-risk for smoking, to experience smoking at higher rates. We know all of this. What we don't have are communities that are equitable to begin with, where people feel like they don't need a coping mechanism. I think one of the misnomers, though, is that some people think of tobacco as a less harmful coping mechanism, and I don't think that's accurate. I think that there are less harmful coping mechanisms. For example, like creative writing or poetry. Like, there's lots of things people can do that are not tobacco related, that are healthy forms of self-expression. We need those outlets to exist in the community, and we need there to be opportunities for people to connect with them. So I think you're right. In general, I think you're right. And one last question over here, and then I'll stick around afterwards for a little bit in case there's any individual questions.
This is less a question than just simply a statement. So we represent UPMC for You, which is a managed care organization for the state of PA. One of the things I wanted to note is that we as managed care organizations were charged with creating a tobacco cessation plan by the Bureau of Managed Care Operations. And one of these items is that tobacco cessation is a billable service for folks that provide care for Medicaid populations that are licensed. So if you're not a certified tobacco cessation counselor, register. You just have to go on the Department of Health site and sign up and take the training, and you can bill for those services. So we as providers within the community can help facilitate that change for individuals too. So they can get tobacco cessation in the places that mean the most to them. Whether it be at their therapist office or whether it goes to their PCP office, they can work with that licensed professional on this topic to get to where they need to be.
So that is a great point, that it's relatively easy to become someone who can provide tobacco cessation services if you're already a healthcare professional. I would challenge a little bit, though, and say that we have a lot of data that shows that LGBT people don't seek care from traditional healthcare organizations overwhelmingly in Pennsylvania. Like I said, only 1 in 5 LGBT Pennsylvanians has a personal doctor. It does, because they're not going to seek care from a traditional healthcare organization. They want to go to their LGBT community center to get tobacco. We have all this data that proves this. People don't want to seek care from hospitals where they don't trust the relationships. I understand that, but people who are licensed professionals need to be in LGBT-specific spaces, and that's what's not happening in Pennsylvania right now. Outside of a couple organizations who are kind of specializing that, we're not yet really providing the services where most LGBT Pennsylvanians say they want to receive them, and that literally means in LGBT venues. And one of the challenges is LGBT people don't know that their care professionals will be affirming. They don't know, so they're scared and they don't go. They don't make an appointment. The denial of care rule makes it worse, because now, if it's fully implemented, people are actually going to wonder if a healthcare professional can say, "We don't serve your kind," and they'll be legally allowed to do that. So the challenge is, I think it is a great option for people who feel comfortable seeking care from traditional settings, but we're trying to get tobacco dependence treatment offered outside of those traditional settings through tobacco dependence treatment at prides themselves. Sometimes that's through a traditional healthcare provider. Sometimes it's not. It doesn't have to be. It can be a variety of ways. And every community is going to be different, and every patient's going to be different. But ultimately, the goal is people need to get care from the person that they're going to feel most comfortable getting it from. If everybody had a primary care doctor, that might be the ultimate option, but we know that not everyone does. If everyone had a therapist, that might be the ultimate option. It is good, though, for people who want to provide tobacco dependence treatment to be able to do it, and for people who don't have access to insurance, they can receive tobacco dependence treatment through the Tobacco Free Quit line for free, and also through some publicly funded tobacco dependence treatment organizations. But that is a good point, that people can sign up and get trained. It's just not the only option. Again, I'm happy to stick around and answer individual questions if there are any. Thanks.